difficulty breathing, abdominal cramps, dry mouth, weakness, these are all signs of botulism, a potentially deadly food poisoning. Botulism comes from botulinum toxin, what we know as Botox, that magic little bottle that keeps us looking young. Now you're probably wondering, why are we injecting our bodies with this toxin? Well, in Harvard Women's Health Watch, 50 years ago it was discovered that injecting small doses of botulinum toxin can actually relax overactive muscles and release the spasms. Today, I will give you a little information about label and off-label uses of Botox. Botox paralyzes muscles so it blocks the release of acetylcholine, which is what communicates the muscle to move. In 1989, Botox was FDA approved for the use of spasms, such as dystonias in the neck and the shoulders, misalignment of the eyes, squinting, eyelid twitching. In 2002, Botox got a second FDA approval. This time it was for the use of cosmetic uses. According to Koutsoulakos, author of Botulinum Neurotoxin, The Ugly Duck in European Neurology, there is evidence that Botox has beneficial influence on 50 pathological disorders. These include spastic paralysis, cerebral palsy, focal dystonia, essential tremor, and headaches. Botox injections have shown to be beneficial in dystonias where therapy and surgery have been ineffective in adults. In children ages 2 to 20 who have acquired brain injuries, participated in a study in St. Maurice, France. They all had pain, they had impairments with daily life activities. The study was conducted in a 22-month period. They were given 51 sessions of Botox along with occupational therapy. And all 25 subjects showed significant improvement with grasping and releasing and pain management. In cosmetics, Botox is used to treat gallbladder lines, which are the ones in between your eyebrows. They're used to treat turkey neck resulting from collagen loss and fat loss. They are used to treat the crow's feet from the corner of your eyes, as well as to soften the corners of your lips and across the forehead. Botox paralyzes the muscles and diminishes the look of visible wrinkles. Botox is widely used off-label for migraines. It paralyzes the muscles that cause the spasms. Botox drops the migraine episodes, however, it does not help the severity of migraines. For golfers, pain relief is found throughout Botox. They get tight heels and they have a lot of lack of range of motion. And when they use Botox, it helps relieve that. Now that we know some of the label and off-label uses of Botox, we can talk about therapies. Botox is a toxin, so there is no one-size-fits-all. Injection doses depend on the patient's weight, what's being treated, the amount of muscle that's being injected. A typical injection takes effect in about 3 to 5 days. The effects of Botox are temporary. They last about 3 to 4 months before they wear off. In migraine therapies, patients have to go back about every 10 weeks for a repeated session, so you have to keep going back. When used for migraines, the patients are injecting the temples, in the neck, and around the eyes. And the cost for therapy varies. Just for migraines alone, you're looking at every session about $700 to $1,200. When doing Botox therapies, muscles do atrophy and they lose some function, but this is reversed when the therapies are discontinued. Now that we learned some of the label and off-label uses of Botox, and we know a little bit about the therapies, let's see about what's in the lab for Botox. With more and more extensive studies being done on this toxin, it holds promise to help patients with asthma, cerebral palsy, post-stroke spasticity, hair loss, pelvic pain, and stuttering, among other things. Dr. Brezenda and colleagues at Catholic University in Rome found significant evidence to link Botox to enlarged prostate glands. They conducted a significant study in Italy where men ages 50 to 80 with enlarged prostates underwent a Botox therapy. They were injected into the 2 lobes of the prostate. Pre-therapy, the average volume of all these men was 54 milliliters in the prostates. And 30 months post-therapy, the average volume of the prostate was 27 milliliters. In the Medical College of Wisconsin in Milwaukee, a team of research led by Barbara Joseph is working on a modified Botox substance to cure asthma and cancer. In natural form, Botox works by slicing up proteins, which blocks the release of neurotransmitters, so this eliminates the neurocommunication between your muscles and the brain. Now, this modified toxin could be used in which the lung cells secrete too much mucus and in cancers where cells secrete too much cytokines. Now, the next step for this team is to bind the modified toxin to the receptors that will ensure that it works where it is needed. I gave you information of label and off-label uses of Botox, injected a little information about the therapies, and we saw what is in the lab for Botox features. I hope you can see Botox in a new light, and as a key to something new and not as something other than vanity and the new drug for celebrities. While we know botulinum toxin can do our bodies harm when ingested, the reverse happens when we inject small doses in our muscles. We help migraine sufferers boost their self-esteem by looking young, help control our spasm, and in the future we can hope to find cure for childhood cerebral palsy. And let us keep in mind that although botulinum toxin started in the wrong foot, with the help of research, it has slowly turned over a new face for all of us to see. And maybe one day you can see that face for a cure. Botox was discovered 50 years ago, and it has a long road to fame, but maybe the best is yet to come.